Good day. We will talk about patient counseling in the following 10 minutes. Who's supposed to do patient counseling? It's the job of the pharmacist. His major duty of counseling patient rather than dispensing the medication. He is assisting patient to use their medication in a proper way. How can pharmacists achieve the proper counseling? Before going to that point, let us see the definition of patient counseling. Patient counseling defined as solving patient problem to improve their quality of health and life. So, how to achieve this counseling? By good communication skill to improve patient counseling by giving the patient better understanding to his illness and the medication that he is using, to improve his adherence to the treatment, toward effective treatment, and to reduce the incidence of adverse drug effects to improve patient quality of life. The key point for doing this: when the patient are coming to the pharmacy and the pharmacist start to counsel the patient, the first thing that he should inform the patient about his medication name, the medication dosage form, how he will take the medication, and the duration of the treatment. He should give in detail the dosage form, the way of taking the medication, the frequency of taking the medication, any warning that related to the using of the medication should be alert and endorsed to the patient. The patient should know the purpose of taking his medication and what is the outcome of the treatment. Also, if there is any interaction between his drug and the food or any other medication, he should be counseled about that interaction to prevent any incident. We should inform the patient about the storage of medication. Is it needed to be kept in the ref or to be stored at room temperature? This is very important for the stability of the treatment and the medication to be stable for the patient use until the end of the treatment duration. Also, we have to inform the patient about the direction of preparing the medication if it's need to be prepared, like syringes, or if any powder antibiotic to be diluted, like such as the pediatric syrups and antibiotics. Also, we have to inform the patient what to do in case he missed any dose. Precaution and should be endorsed to the patient on the way of disposing the medication and the contaminated bottles or contaminated syringes if he uses it, like in chemotherapy. The important thing in counseling is communication. The communication skill is very important for the pharmacist so he can build a trust between him and the patient, so the patient will get the counseling in a positive way and he will adhere to the medication and to the treatment very well. Pharmacists can achieve this by verbal communication. The way of his tone and the volume and the speed of his speech will affect the receiving a message to the patient. Also, the eye contact and the facial expression is affecting the counseling. The pharmacist should break any barrier during the counseling stage. He should be very open and clear to the patient in the way that the patient understands his message to get the proper understanding to his medication use and information. The aim of the counseling should be ensuring the patient know how to take their medication safely and why he's taking the medication. We should always remember that every patient should leave the pharmacy knowing their medication are used for and how to be taking their medication. Always we have to remember that patient counseling will lead to positive behavior by which the patient is motivated to adhere to their medication for a better life. Thank you.